Recording in
hospitalizations.
progress.
We're still recording thousands of cases every day, every week, and we'll continue to see more illness and unfortunately deaths. We do have some treatment options that we are underutilizing. If we think about how well we did with the monoclonal antibodies back during the Delta surge, um, remember, monoclonal antibodies had been around for a while before that, and it took us a while to really embrace it. And Mississippi was really a leader in the use of these effective treatments for COVID. Now we have a new generation of treatments that are available to us. We want to make sure that people know about, know how to access them, and I'll go ahead and present you guys some information. So currently, there are two effective oral antiviral medications available in Mississippi. The first one is Paxlovid. It is a sequence of tablets that you take to treat people within 5 days of illness. It is very effective, but it has numerous drug-drug interactions. So basically, if people are on other medications, you have to be careful that it doesn't interact with your medication and requires significant consultation with a physician or your practitioner. But it is a very good and effective medication. We also have one called Molnupiravir, which is not quite as effective as Paxlovid, but it has less interaction. So they both have a niche and an opportunity to be used to treat people who have COVID. And then, of course, we have the monoclonal antibody treatment. As you know, the Omicron variant is not susceptible to the type of monoclonal antibodies we used during the Delta surge. We do have one called sotrovimab that is useful, but we don't have much of it. We are only allocated about 500 doses a week. And you can see of the doses that have been made available, we only have about 347 doses currently available in the state of Mississippi to administer to folks who have COVID. But if we look at the oral treatments, right, you can see that we have over 2,000 treatment courses of Paxlovid and over 10,000 treatment courses of Molnupiravir available in the state of Mississippi. The other thing we have is a preventive antibody infusion called Evusheld. It's basically a preventive monoclonal antibody for people who are at very high risk because of weakened immune systems. It gives you basically 6 months of induced your immune protection from antibodies through this infusion. It's primarily for people not likely to respond to a vaccine due to immune suppression. And good examples of this are organ transplantation, patients on chemotherapy, or patients on powerful immune suppression drugs. You can see that we've been allocated almost 4,000 doses of Evusheld, and we've only used 135. This medication has been shipped to comprehensive cancer centers throughout the state of Mississippi and also to the University of Mississippi Medical Center through their large and effective transplant program. This is something that we're working to make sure that all of the appropriate providers know this is available, and also primary care docs know that this is available for their patients so they can have them referred for the use of this powerful preventive medication. We have set up at the Department of Health on our website a treatment locator, and this is going to be especially useful for the pills, for the oral antivirals. You can see if you go to msdh.ms.gov/treatment, you can see where treatments are available. We now have distributed Paxlovid and Molnupiravir to Walmarts and Kroger pharmacies throughout the state. So they all have supplies of antivirals. Given the supply, they all have a supply of Molnupiravir, and some do have Paxlovid. But you can go to our treatment locator to find out which pharmacies in the state have these medications, and you can also see which of our hospital and health system partners also have these treatments. So this is not only for our physicians, but also for patients to know what locations near you have access to these wonderful oral antiviral medications. You can see here, you can actually go and select what type of provider you want. You can look at which therapeutic. And here, this is where I select for retail pharmacies. You can see we have fantastic geographic coverage across the state of Mississippi through our pharmacy partners and accessing these effective oral anti-COVID treatments. So that's mostly what I wanted to share today. We are not through the COVID pandemic. We have a way to go. We're certainly in a lot better shape than we were some weeks ago, but we have unused tools in our toolbox, and we want to make sure that everyone is aware that they are available and can help save Mississippi lives. Thank you, Liz. I'll kick it back to you.
All right, thank you so much. We will, and a reminder, I need y'all when you sign in to identify your media outlet or you will be dropped. Let's see. Can you, all right, this is Fox 13 News in Memphis. Can you speak to the importance of the oral meds with the limited supply of monoclonal antibodies? This is from Tom Dees at Fox 13.
Yeah, so you can see that if you look at the slides, you can see that we don't have those many doses um, of monoclonals, right? We got really used to using that, but we have a lot of underutilized orals. The sotrovimab is an infusion, right? So you have to get an IV and you have to, have it infused, and the tablets are a little bit more similar to medications we're used to. So it's super important. And I'll ask Dr. Edney to give me his opinion on this as well.
Yes, the oral medications have made it, much easier to push these out into communities that really don't have access to sotrovimab and have difficulty doing IV infusions. We also, outside of the health department supply chain, have the antiviral remdesivir that hospital outpatient units and infusion centers will have. But as Dr. Dobbs points out, it's also an intravenous, and it's actually a 3-day infusion, but it's another tool that we have. But the sotrovimab being a tight supply and remdesivir being more difficult to administer makes the orals all that more important.
Thank you, Dr. Edney. And Dr. Edney, Tom is also asking, how do you go about getting more people vaccinated?
That is the billion-dollar question. So we keep doing the good work, the health department and all of our health services partners, and educating people and demonstrating the safety and efficacy of the vaccines. And as effective as our antivirals are and our monoclonals are, the most important point of treatment is being protected through vaccination. And we do know that the boosters are extremely important, especially with Omicron. We're seeing drastic reductions in the severity of illness and death for those who have not only been vaccinated, but who've also had their boosters on time. So if you have not had your booster yet, we would strongly encourage you to go ahead and do that as the best source of protection. And our antivirals are fallbacks for when disease hits anyway.
Thank you, Dr. Edney. So Courtney Ann from WLBT, given the increase at-home testing, should individuals who test positive take more initiative to seek out these antivirals and not just assume they need to stay home and stick out their isolation period? That's exactly why we're doing this, because we want the public to know about this. So thank you, Courtney. And Dr. Dobbs, would you like that?
Yeah, no, exactly. We want folks to know that it's available. I think there's a little bit of a misconception that there's not an adequate supply. So there are unused medications, but you will need to call, review it with your physician or your provider to make sure that there's no medication interactions and make sure it's a treatment that's right for you. One of the things about molnupiravir that's important to know is it's not really appropriate for people who might be thinking about getting pregnant, or maybe even for men who want to maybe have a baby, in pregnancy soon. So there are things that need to be discussed with a physician or provider.
Thank you, Dr. Dobbs. Okay, Sarah from McLaren Ledger, who is eligible for oral antivirals? We kind of talked about that, but let's go over that again. If it's only folks with immunosuppression or those at high risk for severe illness because the oral antivirals underuse of because of the oral underuse of antivirals in Mississippi, is it possible to open up eligibility further? Now, I'm under the impression that other folks can seek these out.
Yeah, there's no restrictions on using the oral antivirals for the highest risk. Now, early on, we recommended that people prioritize it for those at highest risk, but we have plenty of medications. So it'll be most important for those at high risk to access the medications, but there's no restriction on who can have access to molnupiravir and Paxlovid. I mean, except for the normal sort of restrictions about drug interactions and people and women who are planning to get pregnant don't need to take molnupiravir.
Dr. Dobbs, I was just wondering, does that shorten the isolation or quarantine period at all?
It does not. It does
okay,
not.
Thank you.
But they will help keep people out of the hospital and keep some folks from dying.
Thank you, sir. Okay, hi, Brenda Goodman from CNN. Why do you suspect these treatments are underutilized? Let's start with you, Dr. Dan Edney.
Well, because we're watching the unutilized stock. The health department monitors what we're sending out, and every physician and provider must report back to us once they administer the doses. And so we're tracking that very closely, and we can tell who's using it and who's not. and we're just seeing numbers that are consistent with underutilization, which is why we're expanding use, getting out to our retail pharmacies, and encouraging physicians and providers, to be more aggressive with treatment as appropriate.
And physicians like Dr. Edney are early adopters. We know that he's obviously very knowledgeable about the treatments and understands the use and also how to counsel his patients. Kind of like with the monoclonal antibody treatments, they were available for many months before we had robust use in the state of Mississippi. So we need to get those sort of midterm and late adopters to go ahead and understand that this is available now. It's available for our patients. I did see another question about, what if folks do if they don't have a doctor or clinic? This does require medical supervision. And so you folks will need to speak to their doctor provider. And, if people don't have a physician, we do have a wonderful network of community health centers throughout the state. So do encourage people to seek out care if they are diagnosed with COVID.
Okay, thank you. Let's see, Jimmy from Jackson, Jambalaya. How many doses of monoclonal antibody treatments are available? You had that up on your slide, didn't you, Dr. Dobbs?
Yes, I'll pull it up again real quickly. So of the sotrovimab, there are 347 unused doses in the state of Mississippi.
For the whole state.
For the whole state, that's out of 4,000 that have been allocated. So we're using it pretty quickly.
Thank you. Courtney Ann from WLBT. Can you describe to people what they should expect if they take one of these antivirals? I know many people reported that they felt improvement pretty shortly after monoclonal antibody treatments. What do you tell people if they're curious about what to expect? Dr. Edney, would you take that?
Sure. I can tell you from treating patients with all the antivirals available, they are very effective and patients feel better, much more quickly. And I can also tell you that Paxlovid tastes terrible, according to the patients. So you just need to be prepared for that and soldier through to complete your treatment. But it is, Paxlovid is as effective as sotrovimab in reducing hospitalizations and death. So, if I were to get Omicron, then and I need treatment, I have no problem pushing through Paxlovid. But all of them are very effective, and patients are reporting just feeling better much more quickly. I personally, Dr. Dobbs, have not seen a antiviral failure yet in the outpatient world. Not yet.
Excellent.
Dr. Edney, have you had to turn anyone away that wanted? I mean, can anyone pretty much with a prescription get these, except for like you were talking about, like the pregnant women and that kind of thing, and men who want to have a baby? But do you pretty much write the prescription for anyone who has COVID?
Yes. If people are really dead set on getting sotrovimab, then most places are just not going to have that. But if they want treatment that's appropriately prescribed by their physician or provider, then that's going to be available. And in our clinic system, we have plenty of Paxlovid and molnupiravir and remdesivir, but we have no sotrovimab. But our retail pharmacies have Paxlovid and molnupiravir all over the state, so I can write a prescription. I have patients around the state. If I have a patient up in the Delta, they don't have to come all the way down. If I can do a telemedicine with them and verify they're positive and that they're appropriate and they need it, then I can call a prescription into their local Kroger or Walmart and make sure that they're cared for appropriately.
Yeah, that's very helpful that Kroger and Walmart are doing that. Don't you think, Dr. Dobbs?
Yes, no, it's been a fantastic partnership, and they have such good geographic coverage across the state of Mississippi. It really helps us a lot.
And
Liz, remember the treatments that are coming through the health department are free.
Of course, yes.
So even though it's going to Walmart and Kroger, there may be a dispensing fee, Dr. Dobbs, but there's no charge for the medication.
Okay, thank you. All right, Brenda from CNN, what will happen to these unused doses if they continue to sit on pharmacy shelves? Can they be redistributed? That's a good question. We have redistributed before, I think, earlier on. So Dr. Dobbs, what happens to the unused doses?
Well, they'll stay in Mississippi. There's not going to be there's not a recollection for the federal sources. But what we've done before, kind of like with the monoclonal treatments, that if we get to places where there's more demand than supply and other places where there's more supply than demand, then we will look at redistributing. And we've done that before with the monoclonal treatments.
All right, this has got to be our shortest press conference on record. Dr. Dobbs, any last words? Main message.
Yeah, so we're not through COVID, but we still have tools. We have unused tools, underutilized tools. I know we're all tired of COVID, but it's still out there. And so we just all want to get people across the finish line. So if you get COVID, talk to your doctor, talk to your provider. If you feel like you have COVID, get tested, because there are things that can be done to give you the optimum chance for optimal health.
And Dr. Edney and Courtney, I'll get your question in a second. Dr. Edney, main message.
And to follow up with Dr. Dobbs, if you test positive at home and you have symptoms, please call your doctor and report in so that your doctor can follow along with you and give you proper medical advice. And most importantly, get vaccinated, get boosted, stay safe.
Thank you. And Courtney Ann is asking, Dr. Dobbs, I know you spoke to hospitalizations in a tweet yesterday. Could you describe the current status, also the increased number of deaths as of late?
Yeah, so we are very excited to see a drop in the number of new cases of Omicron, right? So it's dropped pretty dramatically, which is fantastic. But we all know that our health systems have been battered. They're weakened. The staffing levels are far below what they were before the pandemic began. We've exhausted our healthcare system, especially our hospital folks. So the amount of care that we want to be there is just not going to be there. So even though we're seeing a decline in COVID, it doesn't mean our healthcare challenges, our healthcare crisis is over. And it's really more that we've really denuded, depleted, and exhausted our staff, and especially in ICUs and ER. So that will continue to be a challenge. Now, as far as the deaths go, a lot of those deaths sometimes get reported later because the physicians or the hospitals, there's a bit of a process and a lag. So most of those deaths, some of them are recent because there's a lag from illness, but a lot of them are older deaths, and it's just part of what we expected.